Retrograde ejaculation occurs when semen goes up into the bladder instead of down and out the penis. So, why does this happen to some men? Let's start with an understanding of the anatomy. Here we have a male pelvis. We have the penis, testicles, bladder, prostate, and rectum, the internal urethral sphincter, and the external urethral sphincter, which sits at the bottom of the prostate. And of course, we have the pelvic floor muscles all along here. Those help support the internal organs and your penis. The urethra carries semen and urine out of the body. So how does the semen get there? After sperm is produced in the testes, the epididymis, a structure that sits on top of the testes, stores the sperm. The epididymis is connected to a tube called the vas deferens. During ejaculation, the semen travels along the vas deferens to connect with the ejaculatory duct inside the prostate. It will then travel through the prostate and out of the penis. At the base of the bladder is a muscle called the internal urethral sphincter, which relaxes to let urine out and closes during ejaculation. This is what allows ejaculate to come out of the penis. During retrograde ejaculation, the internal urethral sphincter is relaxed instead of closed. This causes some or all of the ejaculate to travel back into the bladder instead of out the penis. Even though this may sound alarming, retrograde ejaculation is not a serious medical issue and does not cause any physical harm to your bladder or your penis. You can still achieve an erection and experience orgasm. If you have retrograde ejaculation, you may experience little ejaculate during climax, dry orgasms, cloudy urine, or male infertility. So, how is it diagnosed? A doctor will diagnose this by having you empty your bladder first, then masturbate to orgasm. After, you'll pee in a cup, and the doctor will test how much semen is in the urine. What causes retrograde ejaculation? Surgeries that remove or potentially injure the internal urethral sphincter muscle of the bladder. For example, prostatectomy, colorectal, testicular, and some spinal surgeries. Certain neurological conditions like multiple sclerosis, spinal cord injury, or Parkinson's disease. And medications for enlarged prostate like Flomax and some blood pressure, antidepressant, and anti-anxiety medications. Here are 5 tips that can help with retrograde ejaculation. 1. The more you know about how your body works, the less distressing this issue will be for you. Just knowing this is not a serious medical issue will help you focus on pleasure in the bedroom instead of a pathology in your pants. 2. Alpha-adrenergic medications like ephedrine, pseudoephedrine, and tricyclic antidepressants like imipramine may help keep the bladder neck closed during ejaculation. 3. Pelvic floor muscle coordination training strengthens communication between muscles and nerves, potentially reducing episodes of retrograde ejaculation. 4. If this is a cause of infertility, a consult with a fertility specialist is recommended. And 5. Discuss medications that may be causing retrograde ejaculation with your doctor.
Thanks for watching. If you're as passionate about men's pelvic and sexual health as we are, give us a thumbs up, hit subscribe, and spread the word. Let's grow this community together and make pelvic health education accessible to all men and the people who love them.